Question 1. In the context of pediatric sonography, the 3-month-old infant is brought in with suspected hydrocephalus due to increased head circumference. Upon conducting an ultrasound of the neonatal brain, you observe enlarged ventricles with an intact cortical sulcation pattern, but there is no evidence of parenchymal injury. Based on the ultrasound findings, which of the following is the most likely diagnosis? A. Normal pressure hydrocephalus. B. Communicating hydrocephalus. C. Non-communicating hydrocephalus. D. Aqueductal stenosis. Answer. Correct answer. B. Communicating hydrocephalus. Explanation. Communicating hydrocephalus is characterized by the enlargement of all 4 ventricles without obstruction in the ventricular system. In this case, the intact cortical sulcation pattern indicates that the cerebral parenchyma is not damaged, which suggests a non-obstructive process. The ventricle's enlargement and the absence of mass or blockage point to communicating hydrocephalus. It is seen in cases of impaired cerebrospinal fluid (CSF) absorption or an imbalance in CSF production and absorption rather than a blockage. Normal pressure hydrocephalus involves triad gait disturbance, dementia, and urinary incontinence, and aqueductal stenosis would usually present with obstructive hydrocephalus, which is not observed here. Question 2. A 6-month-old infant presents with abdominal distension and vomiting. Ultrasound reveals a thickened pyloric muscle and a narrowed pyloric canal. Given these findings, which of the following is the most likely diagnosis? A. Intussusception. B. Pyloric stenosis. C. Malrotation. D. Hirschsprung's disease. Answer. Correct answer. B. Pyloric stenosis. Explanation. Pyloric stenosis is a common condition in infants often presenting with projectile vomiting and a palpable low mass in the upper abdomen. The ultrasound findings of a thickened pyloric muscle greater than 4 mm in thickness and a narrowed pyloric canal greater than 14 mm in length are typical signs of this condition. It occurs due to hypertrophy and hyperplasia of the pyloric muscle, which causes a gastric outlet obstruction, intussusception, malrotation, and Hirschsprung's disease, typically present with different clinical signs and ultrasound findings. Question 3. During an abdominal ultrasound on a 2-year-old child, you notice a hypoechoic mass in the left adrenal gland. This mass has a heterogeneous appearance with areas of calcification. Based on the findings, which of the following is the most likely diagnosis? A. Neuroblastoma. B. Wilms tumor. C. Adrenal hemorrhage. D. Pheochromocytoma. Answer. Correct answer. A. Neuroblastoma. Explanation. Neuroblastoma is the most common adrenal mass in children and often presents with heterogeneous echogenicity, areas of calcification, and cystic spaces on ultrasound. It arises from neural crest cells and can be associated with metastases, though the mass can vary in appearance. Wilms tumor typically arises from the kidney and presents as a well-defined renal mass. Adrenal hemorrhage would be more like it. Present as a homogeneous hypoechoic mass, and pheochromocytoma would show a more well-defined homogeneous mass with potential for endocrine symptoms such as hypertension, which is not mentioned in this case. Question 4. A 3-year-old child presents with right lower quadrant pain, vomiting, and fever. On ultrasound, the appendix appears to be enlarged with a non-compressible blind-ended tubular structure measuring 7 mm in diameter. What is the most appropriate next step in management? A. Start antibiotics and observe. B. Perform an exploratory laparotomy. C. Repeat the ultrasound in 24 hours. D. Perform an urgent appendectomy. Answer. Correct answer. D. Perform an urgent appendectomy. Explanation. The findings of an enlarged, non-compressible, blind-ended tubular structure measuring more than 6 mm in diameter on ultrasound are highly suggestive of acute appendicitis. The appropriate next step is urgent appendectomy, as delaying the procedure could lead to perforation and peritonitis. Starting antibiotics and observation is not appropriate in this scenario. Appendicitis requires surgical intervention. Repeating the ultrasound or performing an exploratory laparotomy are not the first-line options. Question 5. A 5-year-old child presents with difficulty swallowing and a neck mass. Ultrasound reveals a well-defined hypoechoic mass located near the thyroid gland. There is no blood flow on Doppler imaging. Which of the following is the most likely diagnosis? A. Thyroid muscle duct cyst. B. Parotid gland tumor. C. Brachial cleft cyst. D. Lymphadenopathy. Answer. Correct answer A. Thyroglossal duct cyst. Explanation. A thyroglossal duct cyst is a congenital anomaly that can present as a midline neck mass, typically located just below the thyroid cartilage. It is usually well-defined, hypoechoic, and has no blood flow on Doppler imaging. A parotid gland tumor is less likely in a child and typically presents as a more superficial mass. The brachial cleft cyst would be more lateral in location. Lymphadenopathy would typically be more diffuse and associated with systemic signs of infection or malignancy. Question 6. Which of the following is the most common cause of biliary atresia in neonates, and how does it present on ultrasound? A. Idiopathic biliary atresia with absence of the gallbladder. B. Extrahepatic biliary atresia with a dilated biliary tree. C. Intrahepatic biliary atresia with a normal gallbladder. D. Cold-ductal cyst with the dilated common bile duct. Answer. Correct answer A. Idiopathic biliary atresia with absence of the gallbladder. Explanation. Idiopathic biliary atresia is the most common cause of biliary obstruction in neonates and is typically diagnosed with ultrasound showing an absent or underdeveloped gallbladder, along with no evidence of a normal biliary tree. The condition often presents with jaundice in the first few weeks of life. Extrahepatic biliary atresia is more common than intrahepatic biliary atresia and typically presents with a fibrotic, thickened biliary duct. Cold-ductal cysts typically involve a dilated common bile duct with a visible cystic structure which is not seen in biliary atresia. Question 7. A 2-month-old infant is brought in for an ultrasound after being diagnosed with jaundice. The liver appears normal, but there is marked thickening of the gallbladder wall and small multiple stones present. What is the most likely diagnosis? A. Biliary atresia. B. Cholecystitis. C. Gallbladder carcinoma. D. Cold-ductal cyst. Answer. Correct answer B. Cholecystitis. Explanation. Cholecystitis, an inflammation of the gallbladder, is commonly associated with a thickened gallbladder wall and the presence of stones. This condition can result in pain, jaundice, and nausea. The ultrasound findings, a gallbladder wall thickening with stones, are highly suggestive of acute cholecystitis, which can cause obstructive jaundice in infants. Biliary atresia and cold-ductal cysts present with different patterns. Ultrasound and gallbladder carcinoma is extremely rare in this age group. Question 8. A 4-month-old infant is brought in with suspected cranial abnormalities. Ultrasound shows an enlarged lateral ventricle, but there is no evidence of a mass or hemorrhage. The sulci and gyri are intact. Based on this, what is the most likely diagnosis? A. Hydrocephalus. B. Subdural hematoma. C. Dandy-Walker malformation. D. Brain atrophy. Answer. Correct answer A. Hydrocephalus. Explanation. The ultrasound findings of enlarged lateral ventricles without evidence of a mass or hemorrhage, along with intact sulci and gyri, are characteristic of hydrocephalus. In hydrocephalus, the cerebrospinal fluid accumulation leads to ventricular dilation. Dandy-Walker malformation would typically show a cystic dilation of the fourth ventricle and cerebellar agenesis, which is not described here. Atrophy typically presents with a loss of brain parenchyma, not just ventricular enlargement. Question 9. A 7-year-old child presents with a history of frequent nosebleeds and easy bruising. Ultrasound of the abdomen reveals an enlarged spleen. What is the most likely diagnosis? A. Sickle cell disease. B. Leukemia. C. Thrombocytopenia. D. Splenic rupture. Answer. Correct answer A. Sickle cell disease. Explanation. Sickle cell disease is associated with splenomegaly due to infarction and sequestration of sickled red blood cells. The child's history of frequent nosebleeds and easy bruising suggests hematologic disorder, which is common in sickle cell disease. Leukemia could also present with splenomegaly, but the patient's clinical history is more consistent with sickle cell disease. Thrombocytopenia and rupture are less likely to present with such marked splenomegaly. Question 10. In the evaluation of pediatric genitourinary ultrasound, a 5-year-old child presents with a palpable mass in the left lower quadrant. The ultrasound reveals a solid mass within the kidney. What is the most likely diagnosis? A. Renal cell carcinoma. B. Worm's tumor. C. Polycystic kidney disease. D. Hydronephrosis. Answer. Correct answer. B. Wilms tumor. Explanation. Wilms tumor is the most common renal tumor in children. It typically presents as a solid, well-circumscribed mass on ultrasound. The tumor may cause a palpable abdominal mass, which is common in pediatric patients. Renal cell carcinoma is extremely rare in children and tends to occur in older adolescents. Polycystic kidney disease and hydronephrosis present with cystic changes and not solid mass. Question 11. In a context of neonatal sonography, Mr. Anderson, a pediatric sonographer, is conducting an ultrasound of a newborn's head. The baby was born prematurely at 32 weeks gestation and is currently being monitored for intracranial hemorrhage. During the exam, Mr. Anderson notices areas of echogenicity within the paraventricular region. What should Mr. Anderson suspect based on these findings? A. Choroid plexus. Cysts. B. Paraventricular leukomalacia PVL. C. Intraventricular hemorrhage. D. Cerebral palsy. Answer. Correct answer. C. Intraventricular hemorrhage. Explanation. Intraventricular hemorrhage is one of the most common and critical neurological complications in premature neonates. The paraventricular region is a common site for where the fragile blood vessels are prone to rupture due to immaturity. The presence of echogenicity in the paraventricular zone on ultrasound is highly indicative. If is graded based on the extent of bleeding and its location within the ventricles. It can lead to significant neurological deficits if not monitored and managed appropriately. Question 12. Given the circumstances, a pediatric sonographer is asked to evaluate a 6-month-old baby girl with a suspected mass in the neck. The sonogram shows a well-defined hypoechoic lesion located in the right lateral neck which displaces adjacent structures without invading them. What is the most likely diagnosis? A. Thyroglosal duct cyst. B. Branchial cleft cyst. C. Hemangioma. D. Lymphadenopathy. Answer. Correct answer. B. Branchial cleft cyst. Explanation. A branchial cleft cyst is a congenital neck mass that typically presents as a well-defined hypoechoic lesion. These cysts are remnants of the branchial arches and can present later in childhood or early adulthood. They are usually located in the lateral neck and may displace nearby structures without invading them. Thyroglossal duct cysts typically lie in the midline and present as a palpable mass. Hemangiomas are more vascular and usually have a different sonographic appearance with increased vascular flow. Lymphadenopathy is less likely to present as a well-defined cystic structure. Question 13. What would happen if a pediatric patient with suspected pyloric stenosis is not treated early? A. The condition will resolve spontaneously over time. B. The patient may experience failure to thrive and dehydration. C. Surgical intervention is unnecessary. D. The condition will lead to kidney failure. Answer. Correct answer. B. The patient may experience failure to thrive and dehydration. Explanation. Pyloric stenosis is a condition in which the pyloric muscle thickens, leading to obstruction between the stomach and duodenum. Early symptoms include projectile vomiting, dehydration, and failure to thrive due to the inability to properly digest food. Without early treatment, which often involves surgical intervention, pyloromyotomy, the condition can result in significant malnutrition, dehydration, and metabolic imbalances. It does not resolve spontaneously and can lead to serious complications if untreated. Question 14. Considering the evidence, an ultrasound examination of a 5-month-old child reveals a mass in the abdomen identified as a solid, hyperechoic lesion. The mass appears to be well encapsulated and does not demonstrate any vascularity. Which of the following is the most likely diagnosis? A. Neuroblastoma. B. Wilms tumor. C. Mesenteric cyst. D. Hepatoblastoma. Answer. Correct answer. C. Mesenteric cyst. Explanation. A mesenteric cyst is a benign, fluid-filled mass that can appear hyperechoic or anechoic on ultrasound, depending on its contents. These cysts are well encapsulated and typically do not show internal vascularity. They are usually discovered incidentally during imaging for other issues. Neuroblastomas and Wilms tumors tend to be more solid and may demonstrate vascularity. Hepatoblasts are usually seen in the liver and may also demonstrate more complex features on imaging. Question 15. When analyzing a 2-year-old patient with suspected liver disease, the pediatric sonographer notices a hypochoke, well-defined lesion in the right lobe of the liver. The lesion does not show vascularity on Doppler examination. What is the most likely diagnosis? A. Hemangioma, B. Hepatoblastoma, C. Focal nodular hyperplasia, D. Hepatic adenoma. Answer. Correct answer A. Hemangioma. Explanation. Hepatic hemangiomas are the most common benign liver lesions in children and typically appear as hypoechoic, well-defined lesions on ultrasound. They usually lack internal vascularity, though this can vary in some cases. They often do not require treatment unless they cause symptoms. Hepatoblastomas are malignant and would show more aggressive features, such as internal vascularity, focal nodular hyperplasia, and hepatic adenomas also present as solid lesions but tend to have more complex features, including blood flow on Doppler imaging. Question 16. During the process of evaluating a 3-month-old infant's kidneys, the pediatric sonographer identifies bilateral renal enlargement and cystic structures in both kidneys. There is no evidence of cortical thinning. What is the most likely diagnosis? A. Polycystic kidney disease, PKD. B. Hydronephrosis. C. Renal lymphoma. D. Cystic nephroma. Answer. Correct answer A. Polycystic kidney disease, PKD. Explanation. Polycystic kidney disease, PKD, is a genetic condition that leads to the development of multiple cysts in the kidneys. In infants, the condition often presents as bilateral renal enlargement with numerous cystic structures, though the cortex may remain intact initially. Hydronephrosis is associated with urinary tract obstruction and would typically show a dilation of the renal pelvis. Renal lymphoma and cystic nephroma are less likely to cause diffuse renal enlargement with cysts in both kidneys. Question 17. The primary reason for evaluating the pancreas in pediatric patients is to assess for which of the following conditions: A. Pancreatitis, B. Insulinoma, C. Pancreatic carcinoma, D. Cystic fibrosis. Answer. Correct answer A. Pancreatitis. Explanation. Pancreatitis is a relatively common condition in pediatric patients, often due to trauma, infections, or other causes. It can present with abdominal pain and elevated pancreatic enzymes. Pancreatic carcinoma is exceedingly rare in children, and insulinoma is uncommon. Cystic fibrosis can affect the pancreas, but its primary involvement is in the form of pancreatic insufficiency rather than pancreatitis. Question 18. The most significant aspect of evaluating an abdominal vascular anomaly in pediatric patients is determining which of the following: A. Presence of aortic coarctation, B. Presence of aneurysms, C. Presence of thrombosis, D. Presence of abnormal flow patterns. Answer. Correct answer D. Presence of abnormal flow patterns. Explanation. In pediatric vascular sonography, the primary concern is identifying abnormal blood flow patterns, such as those seen in arteriovenous malformations, aneurysms, or stenoses. Normal flow patterns can indicate underlying vascular pathologies, such as stenosis or thrombosis, which are important to diagnose early. Aortic coarctation is more commonly evaluated echocardiography rather than abdominal ultrasound, and aneurysms in children are relatively rare. Question 19. When presented with a 9-month-old infant who has a history of a palpable abdominal mass, the pediatric sonographer detects a heterogeneous mass located in the left kidney. The lesion demonstrates both cystic and solid components. What is the most likely diagnosis? A. Wilms tumor, B. Multicystic dysplastic kidney, C. Nephroblastoma, D. Renal lymphoma. Answer. Correct answer A. Wilms tumor. Explanation. Wilms tumor is the most common malignant renal tumor in children. It is typically heterogeneous, with both cystic and solid components visible on ultrasound. Wilms tumor can present as an abdominal mass and may cause hypertension and hematuria. Multicystic dysplastic kidney is a non-malignant condition, usually presenting with cysts in the kidney, but it lacks the solid components of Wilms tumor. Nephroblastoma is a precancerous condition that can be associated with Wilms tumor, but it does not typically present with a well-defined mass on ultrasound. Renal lymphoma is also rare and would not usually demonstrate the cystic components typical of Wilms tumor. Question 20. In response to a 4-year-old patient who presents with suspected appendicitis, the pediatric sonographer notes a distended, non-compressible, blind-ending tubular structure located in the low right quadrant. What would the most likely diagnosis be based on this ultrasound finding? A. Colonic diverticulum. B. Appendicitis. C. Mesenteric lymphadenopathy. D. Crohn's disease. Answer. Correct answer. B. Appendicitis. Explanation. Appendicitis in pediatric patients can present with a distended, non-compressible appendix seen on ultrasound, often located in the right lower quadrant. This finding is diagnostic of appendicitis, especially when accompanied by signs of inflammation such as increased blood flow on Doppler. Colonic diverticular are uncommon in children and would typically be located in the colon, not the appendix. Mesenteric lymphadenopathy can mimic some symptoms of appendicitis but would not appear as a distended tubular structure. Crohn's disease is a chronic condition that affects the gastrointestinal tract but is less likely to present with a simple isolated mass in the right lower quadrant. Question 21. A 2-year-old patient presents with a palpable mass in the neck, and an ultrasound reveals a hypoechoic cystic lesion with well-defined borders. The lesion is located between the sternocleidomastoid muscle and the carotid sheath. What is the most likely diagnosis? A. Thyrodorsal duct cyst. B. Lymphatic malformation. C. Branchial cleft cyst. D. Hemangioma. Answer. Correct answer. C. Branchial cleft cyst. Explanation. A branchial cleft cyst is a congenital anomaly that typically appears as a well-defined hypoechoic cystic lesion in the lateral neck. It is commonly located between the sternocleidomastoid muscle and the carotid sheath, and it is often asymptomatic until later in childhood. Thyrodorsal duct cysts are usually located along the midline. Lymphatic malformations and hemangiomas tend to have complex sonographic appearances. Question 22. A 3-month-old infant undergoes an ultrasound of the abdomen. The findings show bilateral echogenic renal masses with associated dilation of the renal collecting system. What is the most likely diagnosis? A. Multicystic dysplastic kidney (ACK), but polycystic kidney disease (PKD). C. Wilms tumor. D. hydronephrosis. Answer. Correct answer. B. Polycystic kidney disease (PKD). Explanation. Polycystic kidney disease (PKD) often presents in infants with bilateral echogenic renal masses and enlarged kidneys. PKD can also lead to cystic dilation of the renal collecting system. Multicystic dysplastic kidney (MCEK) is typically unilateral and does not show dilation of the renal collecting system. Wilms tumor usually presents as a solid renal rather than a cystic one. Hydronephrosis involves dilation of the renal pelvis due to obstruction and does not typically present with bilateral renal masses. Question 23. A pediatric sonographer is examining a 5-month-old baby with a suspected neck mass. The sonographic findings show a hypoechoic lesion with a target-like appearance, and the lesion has increased blood flow on Doppler. What is the most likely diagnosis? A. Hemangioma. B. Lymphatic malformation. C. Thyrodorsal duct cyst. D. Branchial cleft cyst. Answer. Correct answer A. Hemangioma. Explanation. Hemangiomas are benign vascular tumors that often appear hypoechoic on ultrasound with a characteristic target-like appearance. Doppler imaging typically shows increased blood flow, which is a key feature in identifying these masses. Lymphatic malformations are often cystic in appearance with less internal vascularity. Thyrodorsal duct cysts are midline masses and would not demonstrate the same sonographic features as hemangiomas. Question 24. In a 4-year-old child with suspected appendicitis, the pediatric sonographer visualizes a non-compressible tubular structure in the right lower quadrant measuring 8 mm in diameter. What is the most likely diagnosis based on this finding? A. Mesenteric lymphadenopathy. B. Colonic diverticulum. C. Appendicitis. D. Crohn's disease. Answer. Correct answer. C. Appendicitis. The explanation. Appendicitis is the most common cause of abdominal pain in children and is characterized by a non-compressible, distended appendix, often with a diameter greater than 6 mm. This finding is highly suggestive of appendicitis, especially when the appendix is located in the right lower quadrant. A mesenteric lymphadenopathy can mimic appendicitis but lacks the tubular, non-compressible structure. Appendix, colonic diverticulum, and Crohn's disease are less likely to present with such findings. Question 25. During an ultrasound of a neonate, the sonographer detects a hyperechoic lesion in the left kidney. The lesion is well defined and shows no vascularity on Doppler examination. What is the most likely diagnosis? A. Hepatoblastoma, B. Renal lymphoma, C. Renal hemangioma, D. Mesoblastic nephroma. Answer. Correct answer D. Mesoblastic nephroma. Explanation. Mesoblastic nephroma is a benign renal tumor that can present as a hyperechoic mass in neonates. It is well defined and typically lacks internal vascularity. Hepatoblastoma is a hepatic tumor and would not be found in the kidney. Renal lymphoma and hemangioma are less common in neonates and would demonstrate different features on ultrasound. Question 26. A pediatric patient presents with a mass in the right lower quadrant. Ultrasound reveals a hypoechoic lesion with calcifications. There is also the presence of adjacent lymphadenopathy. What is the most likely diagnosis? A. Wilms tumor, B. neuroblastoma, C. teratoma, D. lymphoma. Answer. Correct answer B. Neuroblastoma. Explanation. Neuroblastoma is the most common extracranial solid tumor in children and can present as a hypoechoic mass with calcifications. The presence of lymphadenopathy further supports this diagnosis. Wilms tumor is typically a solid mass without calcifications. Teratomas contain a mix of tissues, but calcifications and lymphadenopathy are less typical. Lymphoma can involve lymph nodes, but is likely to present as a mass with these sonographic features. Question 27. A 3-year-old child presents with chronic vomiting and failure to thrive. On ultrasound, the sonographer identifies a distended stomach with a thickened pylorus. What is the most likely diagnosis? A. Pyloric stenosis, B. Gastroesophageal reflux disease GERD, C. Intussusception, D. malrotation. Answer. Correct answer A. Pyloric stenosis. Explanation. Pyloric stenosis is characterized by thickening of the pyloric muscle leading to gastric outlet obstruction. It is a common cause of vomiting in infants, particularly in the first few weeks to months of life. The presence of a thickened pylorus and a distended stomach on ultrasound confirms the diagnosis. GERD typically does not present with a thickened pylorus and intussusception and malrotation. Different sonographic features, such as bowel obstruction or abnormal positioning of the intestines. Question 20. A pediatric patient presents with suspected diaphragmatic hernia. Ultrasound shows an echogenic mass in the chest with bowel loops visible within the thoracic cavity. What is the most likely diagnosis? A. Pneumonia, B. Congenital diaphragmatic hernia, C. Lung mass, D. Cystic fibrosis. Answer. Correct answer B. Congenital diaphragmatic hernia. Explanation. A congenital diaphragmatic hernia occurs when abdominal contents, such as the bowel, herniate into the thoracic cavity through a defect in the diaphragm. The sonographic appearance of bowel loops in the chest is characteristic of this condition. Pneumonia typically presents with lung consolidation rather than bowel loops. A lung mass would not typically present with bowel structures, and cystic fibrosis mainly affects the lungs and pancreas, not the diaphragm. Question 29. A pediatric patient is diagnosed with a suspected abdominal mass. Ultrasound reveals a complex mass with both solid and cystic components. The lesion shows blood flow on Doppler examination. What is the most likely diagnosis? A. Hemangioma, B. Wilms tumor, C. Neuroblastoma, D. Mesenteric cyst. Answer. Correct answer C. Neuroblastoma. Explanation. Neuroblastoma is a malignant tumor commonly seen in infants and children, typically presenting as a complex mass with both solid and cystic components. The presence of blood flow on Doppler imaging is also suggestive of a neuroblastoma. Hemangiomas are typically benign and vascular, but often present as more homogeneous lesions. Wilms tumor usually appears as a solid mass, while a mesenteric cyst is a benign lesion without significant vascularity. Question 30. During an ultrasound of a 7-month-old child, the sonographer notices a mass with cystic components and peripheral calcifications located in the right adrenal gland. What is the most likely diagnosis? A. Neuroblastoma. B. Pheochromocytoma. C. Adrenal hemorrhage. D. Wilms tumor. Answer. Correct answer A. Neuroblastoma. Explanation. Neuroblastoma is a common adrenal tumor in children and often presents as a mass with cystic components and peripheral calcifications on ultrasound. The adrenal glands are a common site for these tumors, and they can be associated with both solid and cystic features. Pheochromocytomas are rare in children and would not typically show peripheral calcifications. Adrenal hemorrhage typically presents with hypoechoic mass without calcifications, and Wilms tumor usually involves the kidneys, not the adrenal glands.